So today presenting on this topic, we have Suzanne Wagner. She is the principal and founder at Housing Innovations, HI, a group providing consulting to organizations to develop and implement innovative solutions to homelessness. Suzanne has provided training and consultation to hundreds of nonprofit and public agencies throughout the country to expand their capacity to provide effective services and implement evidence-based practices. She has worked with numerous organizations to implement and evaluate critical time intervention, Housing First, and other EBPs. Suzanne has over 30 years of experience in the design and delivery of housing programs and services for homeless people, ranging from adolescents and families to single adults with complex needs. She holds a master's degree in social work from Columbia University and a bachelor's degree from Barnard College. Suzanne, it's your turn now.
Thanks, Victoria. Good afternoon, everybody. It's such a pleasure to be doing this webinar today, and I want to thank Victoria and the Housing Alliance for getting this on people's radar. I was mentioning to Victoria that not a lot of people are really too focused on this new tool, but I think it's actually a helpful tool, and hope that you'll find the webinar helpful. I know I got a list of who was signed up yesterday for the webinar, and I know many of you or your agencies. I also know we have some Housing First wizards on the phone, people who know plenty about it. And throughout the presentation, I'll be pausing for questions or comments that people have or want to add to the discussion, and I hope that's lively. And as Victoria said, please use the chat box. And you don't have to wait till I pause to put a question in the chat box. You can do that as it comes up along the way. What we're going to be doing is first, this is a standards assessment tool, so it could be a little bit dry, and it is a quite extensive tool, although could be obviously much longer. But just to first go over basic concepts in Housing First, and to get everyone on the same page about what we mean, because people use Housing First for lots of different things. Then I'll overview the tool, give you a little understanding of what it's about, how it's set up, how it works. I'll go through some of the key standards that are in there. We actually have slides on all the standards, but I'm not going to discuss all of them because then it will be nap time for you guys. So I don't want to be tedious. And also we'll kind of wrap up with how to use the tool, and maybe thinking a little bit about how HUD is going to use the tool. As I said, Q&A will be woven throughout. What you see on the slide here are embedded documents, and I know that Victoria sent them out already, the printable version of the tool, because the tool is an Excel Excel spreadsheet, which isn't easy to make nice and printing. So we provided you guys with a printable tool, HUD's announcement about the tool and what they said about it, and then we had to just do the report tab of the tool separately for a printable version because of, I don't know exactly why, some technological limitation. So those are all downloadable by clicking right on the links once you guys have the PowerPoints, which will be available, as Victoria said, next week. And if you want to use these to train other staff or share with other colleagues, feel free. So just a basic concepts and kind of frame of looking at this issue, and really we're talking about how to make our homeless system really be housing first when we look at this tool. And it's really about all different types of programs, not just permanent supportive housing, which is, I think, everyone associates Housing First with that model, but really thinking about Housing First as an orientation, a systems orientation that makes every program in your system think about how to quickly house people as soon as possible, immediately after they become homeless, hopefully to prevent it if possible, but to provide immediate, easy access to shelter and then housing. And shelter can also include transitional housing as well as rapid rehousing, with the goal being to really make homelessness rare, brief, and non-recurring, so that we're preventing it, we're helping people access housing quickly to make it brief. And then, this is an important part of Housing First, we're providing services post-housing to help people maintain stability, follow their lease, and not return to homelessness. I'm sure many of you know this, that Housing First is a huge paradigm shift from something we used to do in the 20th century a lot, which was use a housing ready model and said people had to be sober, they had to be in treatment, they had to take their medication in order to be ready for housing. And various people, starting with Pathways to Housing in New York, started to turn that concept on its head and, really approach it from the perspective that everybody's ready for housing. And that if we provide supports post-housing, people will be able to be stably housed, many, many people, even if they have complex conditions or multiple needs. And there's been numerous studies and lots of evidence over the years, 20-plus years of evidence that the model does work. The term is used to refer to a program model of permanent supportive housing, the Housing First Permanent Supportive Housing. I think we have some agencies on the phone that actually run that model, but it's also, as I said earlier, a system-wide orientation. And this new tool from HUD really reflects that system-wide orientation, and what they've done is to start to define what does Housing First look like for not just permanent housing programs, but for shelters, for transitional housing, for rapid rehousing programs. And so there are elements of Housing First that can be applied to all different types of programs, and that's what we'll be getting into later. Just some of the core practices in Housing First. Quick access to housing while connecting people to services. There's a clear path for people, and that includes choice of where they live and what kind of housing they live in and who they live with. It's also low barrier in entry. We don't put a lot of requirements on people being able to come into the program if it's a Housing First program. Of course, basic safety and the ability to be safe with themselves and other people is a threshold requirement. We're not taking unsafe people in, but otherwise we're removing unnecessary barriers. But it's a high expectations model. We expect that people will be able to follow the lease, follow the program rules, and use a behavioral approach that's based on a harm reduction. So if people have behaviors that interfere with their ability to stay in a housing program, shelter program, thinking about how can we reduce some of those problematic behaviors so they can make it work and follow the lease and live by the same rules we all do. The difference in Housing First from most of us probably is that there's support staff available to help engage with a person, and it's an assertive engagement model. You'll see in the HUD standards they're very clear on services being voluntary for the participants, not for staff. Staff need to offer assertive engagement, but they're very focused on the voluntary aspect of Housing First, which varies from program to program. But no matter what program model you're using, the onus is on staff to make services attractive and to engage people in services. Even if people are mandated, if they're not really engaged with you, we can't really do very good work. And then finally is really teaching skills and teaching people tenancy skills, helping to teach eviction prevention, connecting with landlords, and helping people connect to community resources. And, Housing First is a lot of dimensions. It has a lot of domains. But these are some of the things that are really core and you'll see come up a lot in the standards. And some of you have seen this slide because I love it because it's, I think, one of the concerns that has been raised about Housing First is that people, it's just like let people do whatever, and there's a tolerance for things that may be unsafe or unhealthy for the person. And I think it's important that Housing First is about helping people live a good life. It is about recovery. It's not housing only. It comes with supports, and it's not anything goes. I don't know how clearly this picture projects, but it's a couch with a burn mark on the arm surrounded by thousands of cigarette butts, apparently using a plastic cup as an ashtray. which is a health and safety violation. It's a hazard, and is obviously something that we don't want to walk in on. We want to be working with people from the beginning to teach them how to be a good tenant, how to follow a lease, how to maintain an apartment, not assume people know how to do that, and help them live as good a quality of life as possible for them, as well as following the lease and getting support services. I'm kind of cruising through this fast, and I can talk very fast because I think many people know it, but I, as I said, want to make sure we all have a similar lens. I mentioned assertive engagement, using motivational techniques, helping to realize that people's motivation varies over time, and we can help actually people become more motivated for things that are going to make their lives better. We do housing stabilization plans with people in Housing First. We're thinking about who they are and doing a comprehensive assessment. It's person-oriented and recovery-oriented. You'll see this a lot in the standards. There's a lot about person-centeredness and individual choice and goals. Housing First is also in the community, in the home, and connects people up to community supports, not just formal social services, but to a life in the community, to things they like to do, to fun, to the arts, to the library, to their community. And Housing First, as I mentioned before, I think originally was really applied only to permanent supportive housing, but there's been so much evolution on the concept that we can think about what does it mean to be Housing First in a shelter, what does it mean to be Housing First in outreach, what does it mean to be Housing First in transitional housing, and there's things in the standards on that, but I think the general thrust is that thinking about the crisis response system and the homeless system as a system to respond to people's immediate housing crisis, get them quickly connected to permanent housing, and connecting in the most vulnerable through street outreach and people who are not traditionally engaging into the system, and having rules that are similar to the rules that any other housing program would have, and removing barriers to access, which has been a big issue in some communities, and really getting a handle on homelessness and reducing the number of homeless people in the community is there are a lot of barriers to accessing shelter or the homeless system, and so people are just not served. And if we're going to end homelessness, it includes all those people who are very vulnerable. So, I mean, and the other part of Housing First is thinking about how do the things that we're doing in our program help or not engage people in services. When we're talking about Housing First in permanent housing, we've talked about what does that mean for transitional or rapid or PSH, quick access, separation of the housing and support services functioning. This is a really important part of Housing First, and that the case management is not expected to fulfill the landlord's role, and that the landlord or landlord designee fulfills that role and holds people to their tenancy obligations. That's really core to the model, so that the case management or support services staff can help people learn how to follow the lease. But we need a landlord or someone to hold out the expectations. Talked about skills and preventing eviction. We have to focus on income, obviously, if we're going to help people make it in housing, and there's quite a bit in the standards about helping people connect to benefits, to connect to jobs, and that also has to go to role and purpose and structure for people, and having more money, which most people want in life, but also connecting to a life and goals beyond just getting housed. Not that housing is a minor thing, but after people are in housing, what's next? And then I mentioned the supporting of choice and connecting to supports, which I think is a really, as you'll see, is also key in these standards. Okay, so that's just the basics, get everybody on the same page. I don't see any questions that have come up or comments in the chat box, but I may not be looking at the right thing. Does anybody want to comment or add to this or highlight anything, or disagree, of course? It's always that option.
And you can also unmute the line by pressing *7 if you want to speak up or ask a question at this point.
Oh, great. Thank you.
Mm-hmm.
I must have been clear, Isabel, and I know hopefully this is consistent with what most of your thinking is on this. You know, it's not so much science. There's a lot of definitions out there on Housing First. Okay, so now what is this tool? How does it relate to the Housing First model and a Housing First system? HUD released this in September. And it built on what the United States ICH used to have a Housing First checklist. I'm sure some of you have completed that to assess your programs and are they Housing First. Excuse me. And this kind of goes beyond that checklist and is a tool for programs to assess how closely they align with what HUD has defined as 35 Housing First standards of practice. And so my guess is some people will agree with some of the standards that HUD's using and disagree with some. But I think what's most important to know is they're not coming from a researcher. They're not coming from it's not a fidelity scale, although it does assess fidelity to the model. But these are HUD's Housing First standards of practice. So I just want to make sure that's clear. And they've made them applicable to all types of programs that are funded through the HUD Continuum of Care, coordinated entry, outreach, emergency shelter, transitional housing, rapid rehousing, permanent supportive housing. And there's slightly different, there's a set of 5 different sets of standards, and they don't all apply to all of the different models, and I'll get into that later. For every standard, so all 35, the community or the program needs to evaluate whether they just do the standard, like people have leases that are renewable. Do they just say it? Do they document it? Is that written in policy, or do they do it? Is there evidence that everybody has leases? In other words, is there a lease in the chart? And then within each, can be a little bit tedious because it's 35 standards. Then you have to rate it, say it, document it, do it. In some cases, it might be 1 or 2 or all 3 of those things. And then the degree to which you are saying it, documenting, or doing it. Not at all, somewhat, or always. So it gets pretty granular. It scores up to 216 points, and there's a little scoring meter at the end, and I'll show you that in a little bit because it auto-calculates your score based on your answers and the things you input into the tool. And it also tells you what you're not compliant on, by the way, which I'll talk about a little bit more later. A little bit more about the tool. I know people love Excel spreadsheets with multiple tabs. I just know that. And that is exactly how the tool is prepared. And I'll give a little screenshot of that in a minute. The 7 tabs are listed on this slide. There's some instructions which appear to be cut off at points, so hopefully HUD will provide a little bit more instructions on this. There's a tab for providers to enter some basic information about their program. And I just want to stress that this is a program level assessment. This isn't assessing your system or all of your PSH. This is done on a program level. Now, you could aggregate those results and say, okay, how did all of our transitional housing do on this or something like this, but this is basically a program level assessment tool. So provider information collects some basic information about who you are and who's completing the form, et cetera. And then there's a couple of drop boxes that you need to fill in because that's what determines which standards you complete and goes into the scoring. So you have to put in your program type and if you serve one of these 3 populations, youth, TV, or people in recovery. And then, so that's like instructions, basic information, and I said 4, but there are really 5 I said 5, but there are 4 substantive tabs that each have a set of standards. And I'm going to go through those one by one in a minute. But there's access and input or evaluation, and that relates to how do people get into the program, and then do people have an opportunity to provide input, participants into the program. And there's standards, those standards apply to all programs. Then there's standards around leases, and that includes, and shelters don't generally give leases, transitional housing, rapid rehousing, and permanent supportive housing. Then you apply to that cohort. Then there's a tab for services and housing, and that's some standards around what kind of services are provided, as well as how the housing works and is operated, and that's for emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing. And then there's project-specific ones, and those could apply to all program types, but certain questions are only related to if you're a recovery program or if you're serving a specific population, but I'll go through that. But no matter what program type you were, you would at least take a look at that. And then the final tab, which is a report summary, and it auto-calculates your score, the percentages of the standards that you said you say, the percentage that you say are documented, the percentage that you say that are done, and then it gives, I haven't actually seen it completely filled out, but it lists all the standards that you're not compliant on. So this next slide, I don't know, I guess it depends on how big your screen is, how well you can see this. This is the first tab, the instructions tab of the Housing First Standards Assessment Tool. And that's the instructions tab. And you can see when I said there's 7 tabs, that there's, as you use this tool, the spreadsheet, you need to click on each tab to open the different topics that you want to work on. And you need to go through the whole thing, and then the report summary will auto-generate. This screenshot also shows you the different project types over here and which standards are applicable, so you know which tabs you need to be completing based on what kind of program you are. And these are the instructions, and you can see, well, let me make my little show you where the overview gets cut off right here. A Continuum of Care can use this tool too, and that sentence never ends. So a little bit of a mystery there. And then you can see also in the scoring, it details further. There's a little bit more instructions on what does it mean to say something, what does it mean to document something, and what does it mean to do it if you're going to evaluate yourself. And saying means people can talk about how they do it, what is done, and that's consistent. Documentation means things are written in policies and procedures, handbooks, or rules that document these practices. And then do it means that there's evidence that we do it, we know we do it, we don't just say it, we actually do it. And there's also a place for notes. And then this tab also further explains a little bit more about each of the different tabs. Okay. So let me just stop there again in the interest of giving people an opportunity to ask any questions they have. You're very quiet.
It's *7 to unmute.
Very quiet today, Friday afternoon crowd. Maybe eating a little bit of lunch there, which is good because got to take a little break. I must be clear as a bell or clear as mud. All right. I'm going to keep moving on. So as I said, I'm going to go through just what are the standards in here. What is HUD saying Housing First is? Again, some of you may agree. Some of you may agree with some, all, part. But this is what HUD says. So there's access and input. This is about how people get into the programs, and it applies to everything and how people have input. And it, of course, restates the low barrier and not having unnecessary conditions for admission. I think that's good language, that we don't put requirements on people to come in that don't really have a good reason for them. And that we are complying with equal access. Throughout here, we have to comply with equal access and fair housing, which are laws anyway, so now they're incorporated into the standards. But they specifically call out access regardless of sexual orientation, gender, and marital status, and being in compliance with the equal access rule. This is not an equal access training, but that has very specific meanings around not separating families, around serving people with their identified gender. And I know Pennsylvania's done a lot of work, and I think the Alliance even has on this, but it's an important issue. Also, with the standards in here, admission is expedited, that we help people with documents to get into our programs, so that if we do have a separate application, for example, or people need documents and they're planning to come in, that we help them collect whatever paperwork that they need. that the intake process is person-centered and flexible, that we look at people's strengths, the resources they bring. They specifically call out not having any specified appointments, which, I think you probably want to have a combination of some drop-in and as well as some specified appointments, because then people can predict and plan their lives around it. But for some reason they chose to kind of drill down on that detail. There's not consistent level of elaboration, by the way, of each of these standards. So when you go into the spreadsheet, each of the standards has a little more explanation. I tried to pull out the highlights, but in some cases it's much more extensive than in others, and in some cases it's not quite clear why certain elaboration is there. But I just point out there is more explanation. Other things about access is that you get your referrals into your program and out through the coordinated entry process. That's a reg now anyway for COC programs, so that's part of the Housing First standards, but it's really coordinated entry. And that we're avoiding exits to homelessness, and that if people do not make it in whatever program we're running, that we are trying to find an alternative solution and prevent them from having to return to the homeless system. And there are a couple of standards in here related to people needing a hiatus from our program, people not being in our program but continuing to receive services. And I think that that's probably, as I reflect on it, something that might be a little bit difficult for some programs to actually implement given their funding sources and the way they work. But I think it's good because it's thinking about continuity of care, and I guess that's a theme that comes through in these standards, is thinking about if the person is coming into our program, what does that look like? If they're moving on to another program from us, what does that look like? Are we doing warm handoffs? Are we trying to prevent people from falling through the cracks or into gaps in the system? So I think that's actually a welcome set of standards. And then on this dimension, there are two standards around participant input and education. And so one is around people getting a lot of education, people who are in our program, that they understand the Housing First model, which I thought was interesting that they are advocating to explain the model to people. And certainly practitioners know that you often do need to explain the model because it's very different from the way things have been in other programs. There's also education very specifically around lease compliance and being a good tenant, which I think is, again, also very core to the practice. And then that projects have regular, ongoing, formal ways for people to give input into the program, and that could be through advisory boards, through surveys, consumer satisfaction surveys, having peer input sessions, having suggestion boxes, but that there's, and maybe quarterly meetings or a regular set of meetings, but that there's regular ways for people to give input into the program. And that, of course, helps if we listen to people and change our programs for people to engage more with our services if we're providing the things they need. So that's the access and input standards, and that's 9 standards. You can see at the top of each slide 9 standards in that tab of the spreadsheet. And then when you click over the next tab, this Leases tab, there are 7 standards. And these apply specifically to the transitional housing, rapid, and PSH, permanent supportive housing. The housing is considered permanent. Leases are annual leases that automatically renew. There is provision for transitional housing to not have 1-year leases, of course, because people may be staying shorter amount of time. That choice is fundamental, that people, and I mentioned this earlier, can choose the type of housing, the location, that if we're doing shared housing, we're not forcing people to live with roommates that they didn't select. We know this has a lot to do with housing retention and stability, as if people feel some equity in where they live, they connect to it because of the neighborhood or something about it, or their wishes and their choices have been honored, that they're more likely to invest in the housing and try to make it work and follow the lease and maintain stable housing. Of course, choices are limited, money, by background that people have, and we are subject in many cases to landlords, and they have their own criteria. But we certainly want to have that conversation and understand what people's choices are and work to accommodate that as much as possible within the limitations of the situation, but also helping people think about maybe this housing isn't exactly what they want, but connecting to a future and having some success in housing now will give them more choices in the future. But it also is about informed choice and not just saying this is what the person chose. If they didn't really know what the options were, then that's not really choice. So I like that choice is very strongly emphasized in here, and I think it's something that's very important for us to help people make decisions for themselves and have all the information. Also around the leases, that the leases are standard provision, that they're similar to any other renter. No conditions added unless it's a funder requirement or a time limit if it's transitional. People get education on their leases and access to legal services if they need them. That services are focused on eviction prevention, and evictions follow due process, and also comply with the Violence Against Women Act, which is where the victims not evicted part comes in. It's another federal rule that is clearly referenced, and I meant to actually mention at the beginning that there's HUD calls out being careful how this is used when we're talking about serving people who have been victims of violence, and making sure, and we'll see this a little bit later in the services, that we're doing a trauma-informed practice and maintaining confidentiality, and if people need to be transferred for their safety, that we're doing that, and that we're complying really with federal rules around VAWA. This is next one, number 6, stable housing is a priority. That's what the standard is written. And then when you read the fine print on that one, it says that we hold units for temporary absences. Say if somebody needed to go into treatment or maybe was incarcerated briefly in a jail or something like that, that an effort is made to hold units. And certainly that's possible depending on the model. But it probably something some programs may have to think about. And then rent payment policies are responsive to tenants' needs. I mean, we are working with folks who have vulnerabilities, who have some limitations. People may need help getting a rep payee. They may need special payment arrangements because of the way their money comes in or the way they receive funds from other people in their lives. Excuse me. Interestingly, they don't mention reasonable accommodations in here, but certainly when I read this standard, I thought, well, certainly would be a reasonable accommodation to say, well, this person gets paid on the 5th of the month, so their rent is due on the 8th of the month. And that's, I think, an example of a responsive rent payment policy. So the standard here is not very detailed, but I think reasonable accommodation actually gives us a lot that for some reason is not completely acknowledged in this tool. Okay, so that's 2 of the 4 big tabs. So that's 16 standards, just a little less than half. Are there comments on these standards? They're not very detailed. When I say there's a little blurb explaining them, it might be 2-3 sentences. Obviously, I have an orientation when I read them. You may have your own orientations when you read them and questions that come up, but I would definitely say that probably all questions are not answered. And I think that HUD said that they were going to be providing some companion tools with this, and so maybe also some help with frequently asked questions, because I suspect that there might be some frequently asked questions. Okay. I'm still clear as a bell, so I'm just going to proceed to the next slide. Talk about the services and housing tab, and this is kind of a big one, and it takes up 2 slides. And this first slide focuses on the services standards. So there's 7 standards for services and 4 for the housing, which are on the next slide. This tab in the spreadsheet applies to emergency shelter, transitional housing, rapid, and PSH. A lot of things already been previewed in the tool in other places. People have a choice of services from an array and get housing stabilization support services. So they're really specifically calling out not just case management, but specialized housing stabilization support, housing-focused case management, and I think that's good. That's reiterated. Person-centered planning is a principle of the planning process. I know many of you, because I know your agencies are trained on this and oriented this way. For some agencies it may be newer. Services, are as permanent as the housing. So if it's PSH, obviously services are as long as people live there. But that also services are made available for up to 6 months for aftercare after exiting transitional housing or rapid rehousing. And I think this is a really welcome standard. We know certainly from studies as well as from people in the field that first 6 months is so critical time for people. And if we can help people stabilize and provide some extra supports for them to figure out how to follow a lease and be a good tenant, that there are lasting results to intervening during that time period. And that aftercare is probably one of the most important services that a temporary program or time-limited program could offer. So that's very welcome. Again, here, this is the little hiatus theme coming up, that services continue even if housing is lost or the person needs hiatus from the program. And they're suggesting that whoever's engaged with the person providing support services maintain their connection even if the person becomes homeless again or if the person needs a temporary stay and treatment. I think that's pretty doable. I think if people leave the housing, we want to obviously try and connect them through a warm handoff to something else. But that's definitely probably going to require some program development work for people. Services participant engagement is a core component of service delivery, that there's an assertive engagement model, that we're clear about our role and how we can be helpful stabilizing in housing, and using warm handoffs. And I see Shannon wrote in a question about the 6 months. Yes, you can provide 6 months follow-up after PSH, and that's implied. I just didn't call it out because it was the aftercare I wanted to highlight. But yes, you can. So we are assertively developing relationships. If we're unable to engage, this is really not saying, well, the person is resistant or won't engage. It's what can I do to engage with you? How do I change my approach? What is it that I have to offer that a person can find useful? And really using that orientation to all of our approaches to services with people. And in that vein, really, in terms of engaging as being culturally and linguistically appropriate, also being family friendly, which they specifically mention in terms of policies, and specifically called out parents of children not having to completely supervise their children in programs at all times, like when they're showering or going to the bathroom, which I thought was interesting. And again, not consistently did they get to the level of detail, but every once in a while they do. And then they also talked about, the last standard here on services is that staff are trained, this is a strange one linguistically, but in clinical and non-clinical strategies, they specifically call out harm reduction, motivational interviewing strategies, being trauma-informed, and using strengths-based techniques. Okay, I see another question came in, so I'm actually going to try and read it. In my program, we provide aftercare for families for a year. However, I've noticed that families are not sticking with it and are continuing to participate in aftercare. How to continue to have them engage and participate. Yep. Okay. So I think that goes to something I kind of went over really quickly in number 5. It's about role and how can we be helpful. And there's actually going to be some sessions at the Housing Alliance Conference next month. Hopefully some of you are going, around engaging people in services and voluntary services. And I think it's, really shaping that aftercare so that it's meaningful for people, that they know what they're getting from the service. I think being able to offer 12 months is fabulous, but not everybody might need 12 months. And I think that's maybe also a reasonable expectation to have for people. I will tell you, and when I was working in services at CUCS, there's nothing like little incentives if we can do it. Sometimes we were able to, fortunately through a foundation, to offer families diapers for if they came for aftercare. And let me tell you, our return rate was astronomical. So I do think now sometimes you don't have resources that happen to be free, but really thinking about how to frame that service, doing assertive engagement with people, maybe having a way for people to come in for events that might benefit their kids. A lot of times people will go to events for their kids, and that's a good way to engage the parent. In terms of Kimberly's question on how long is short-term inpatient treatment, they don't actually get specific. They talk about words like hiatus, short-term. That's why I think they're probably aware that there's going to be different funding requirements that may or may not allow that to happen. I certainly think anything more than 90 days is not short-term, but let's be clear that they do not specify that, and that may be something to come out in the FAQs. Okay. No training line item in the budgets. I know. I agree with that. Everyone could see the comments, I think so. But your planning funds can be used. Yes, I just want to mention planning funds could be used for training.
Sorry, the comments are only viewed by, I think, the person who submits it and yourself. So.
Oh, I'm sorry. Okay. So Shannon wrote, interesting that they are evaluating based on the degree to which staff are trained but don't have a training line item for staff in the program budgets. It can be taken out of admin, but that's usually used for supervisory support. So agreed on that it would be very useful for them to allow training, and it's obviously statutory why they don't allow training in the program budgets. I do want people should think about using their potentially planning funds to provide training on some of these things. I think a lot of communities have been using those resources that way. Certainly in order to deliver these services this way, people are going to need training. Okay, great. Thanks for the comments and questions. So now the other part of this tab, services and housing, which you could say could have been 2 tabs, but for some reason they wanted to put it all together. There's 4 standards on housing. And so being in housing is not contingent on participation in services or completing your service plan. Services are voluntary for people, but not for staff. So staff are continually engaging and offering services. This is a sticky point for a lot of programs and a lot of agencies. But I think my experience, and I'm a practitioner, and we've done a lot of work on this, is that people, if they need services, will often have issues following their lease or lease violations, and that's an opportunity to bring up the need for services and potentially connect people when it's going to potentially prevent them from losing their housing or help the landlord consider not moving towards eviction, and it's a great harm reduction tool. Substance use in and of itself is not a reason for termination. It's behaviorally based. So if I use substances and I'm engaging in criminal activity or destroying property or putting others at risk, obviously those are lease violations, but use in and of itself is not a reason for termination. That the rules and regulations are centered on participants' rights and protecting them, which I thought was a very interesting inclusion here. Rules support a stable community but don't interfere with people's life in the community. It's actual language that I should have put quotes around it because that's explanatory language that's in the spreadsheet, and that pets are okay. And except for shelters that are nightly shelters, like overnight shelters, people should be able to access their housing at all hours and not have limited access to their housing. So this is a challenging one, the pets one. I know it's obviously very important for homeless people. Pets are their family, but that's also a challenge for providers. I do know a shelter in Nevada, they have a kennel for pets. And it's a great thing. It's brought a lot of people who would never come inside, were living out in the desert, into the shelter so they could work with them on housing. And then finally, the last housing standard is that people have a right to transfer to another project if threatened with imminent harm. I mentioned this before, that this is really really a VAWA requirement anyway, but it's good that it's specifically called out here so people are aware that that's the right thing to do. Okay, so project specific, the last set of standards is a project specific, and it specifies by question which programs it applies to. And there's 8 different standards. Sorry, I have a typo. It's 5 for the project and it's 3 for the population on the next slide. So if your rapid rehousing access is quick, it's less than 30 days. For some reason, they felt like they needed to say that rapid rehousing services support maintaining people in housing. That's woven through all the services things. But I have the kind of sometimes a little bit of the sense that maybe multiple people worked on this document and that things didn't always get all lined up. But that rapid rehousing support housing stabilization and maintaining it. This one, number 3, applies to everybody. Projects continually assess participants' needs for assistance and tailor services accordingly. This is about an individual choice model, and it's also about individual need model and making sure we're adjusting services based on individual needs, which is also a challenge and means we have to have good resources. The 4th one is for transitional housing, that it's focused on safe and quick transitions to permanent housing as soon as people can, so that it's not automatically 2 years, even though people can stay for 2 years, and that if people are interested in moving on, that we should help them move as quickly as possible. I like to say, but they didn't use this language, that the intended length of stay is as brief as possible here, instead of saying we expect you to stay X number of days or Y number of days, that it's really individualized to helping you and your family or whoever get out as quickly as possible. And that transitional housing projects provide appropriate services that meet population needs. So this goes to some of the special populations, if it's youth or DV, and that services are not required in order to participate in the housing. So they specifically call that out, even though that was in the previous standard around transitional housing. They know that that's a change for some programs. The last 3 standards, oh boy, this is really, it's a lot of standards, but the last 3 are for population and specific model types. So remember I said when you do the first tab where you enter your provider information, you have to enter what program model you have, but you also would indicate if you're recovery housing there. If you are recovery, but this does not only apply to recovery housing, the 3rd one does, but this is about services and housing options that people have available to them, is that recovery housing is a choice among other opportunities, and that the services that people get are based on what they themselves want and choose. And that it really specifically calls out abstinence bases are offered if people want them. So this is not generally standard things that are included in Housing First standards, but I think it's making a point that as a social worker I think is really important, is that we want to accommodate people's recovery wherever it is. And some people want abstinence, and some people want harm reduction, some people are in different places, and that the path to recovery is individual, and we support individual paths to recovery. And that's really the language that's in the standards, and I think for probably most of us it's hard to disagree with that. That also we include relapse support. We don't automatically discharge people for relapse. That applies pretty much everywhere. And that if we are a recovery housing project, which is number 3, that we are supporting sustained recovery by providing services based on choice. And if people, and again it calls out abstinence-based services if people want them. So that is all 35 standards there. And after you complete all those standards, you get a summary report. Now this is blank because it was not completed, but you can see you get a little meter over here and percentage of your standards that you said, percentage of standards documented, and percentage of standards done, categorized by you're sort of done, not at all, or always. And this report automatically populates once you're done with this, completing the standards, and then it will calculate your score. So I'm going to last part is I'm going to talk about using the tool. So let me just stop there and see if there are any other questions about the standards themselves. Okay, great. So, oops, I didn't click the right place. So how are we going to use this tool? What does HUD say? HUD says a couple things. And it can start and support conversations about housing first. You know, communities are in lots of different places around housing first. I think permanent housing, housing first models have been in place longer, the longest of any models. Applying housing first principles to shelters and transitional housing programs is newer. It's certainly the wave. We're hearing in our practice here at Housing Innovations lots of people wanting to talk about and train staff on what does it mean to be more housing first as a shelter or a transitional housing program. And we know there's been a lot of changeover in those programs so that they can adopt elements of housing first practice. So the tool can be used to definitely continue discussions and make sure people have a common understanding. And it does get a little more detailed than the Housing First checklist. Certainly I think educating executive staff and managerial staff on the model, it's actually I think pretty for that level of staff. The tool I think is an accessible resource to help educate them on the model. I certainly, because I think of a few people I'd like to work through it with. It can also be used by the team, by your team at your program, or the COC, you know, can do a review and identify, you know, areas where you want to develop the program or change, standards you want to be able to meet all the time, saying it, documenting it, and doing it. It doesn't prescribe, HUD doesn't prescribe who should be assessing it. It just gives a box for whoever did complete the form. I think you could sit around a table as a group and kind of go through it. I think that's what I would do if I was running a program. But it could also be done as a, you know, program staff can do it as a self-assessment. Some of your agencies are big and you have quality assurance people who might be able to do it, or the team leader or program supervisor could, you know, complete it. I always think it's better to have staff complete it at the same time. Could be done, you know, if you wanted to use it in your community or your COC, as like peer agencies lead them for each other. We use something like that within our evaluation in New York City, where we include peer agencies in that, and that's been very helpful. Could be done by staff from a COC lead support agency. If your COC has a lead support agency, they could administer the tool. Could be staff from a government agency if they're involved. I mean, it doesn't prescribe who can do it, doesn't say who can do it or who can't do it. And then the other thing that HUD makes note of is that you can use this sort of assess your progress today and then say a year from now or 6 months from now after you've implemented any program changes. So, and it's very concrete. So those are just some suggestions. And only a couple minutes left, so I'm going to get to my last slide, which is how will HUD use the tool? So I consulted a psychic because we don't really know on this, and I could see a few things. I could see HUD perhaps requiring agencies to conduct a self-assessment and report their score. I could see them at some point asking the COC how many of your providers have done the Housing First assessment, and points get attached to that. You know, that's how HUD gets us to do things. So it certainly could be incorporated as a requirement. I will just say right now it is not a requirement. It is a recommended tool. And I guess, you know, it's very new, and you're really the first people that I've spent some time talking about this with, and I think thinking about, we'll probably be hearing more about how HUD sees the tool being used. As I said, they're talking about companion materials, but I would assume that this tool will be used in some way by HUD at some point or reflected. And so if I was a COC, I would certainly bring it to a meeting and go over it with people, make sure people are aware of it, and maybe even encourage people to do it themselves. I think it's a useful tool, and hopefully they'll adapt it over time as people give them feedback. So that's my last slide. I'm going to wrap this up. I see a couple of questions came in. Let me take that. Would you suggest this? Would you use this or suggest using this as a type of program monitoring, or are there many more requirements for monitoring that aren't covered in this tool? Yeah. So monitoring programs for HUD compliance is this tool does not do that, because there's tons of HUD standards and regulations that if they were to come out and monitor you on is not these standards. And that is a different, you could combine them, but they are looking at very different things. A HUD monitor and program monitoring would look at use of funds, eligible uses of funds, all the compliance with the HUD regulations. So there's some duplication in the sense of compliance with fair housing and equal access and VAWA and so on, but it is really looking more at more granularly at the program model than a monitoring would. So any other questions coming in? Okay, timing is everything. It is 12:59. So I want to say thank you to the Housing Alliance for sponsoring this. It's very forward-thinking of you. I hope that people have found this helpful. I think that it's a tool that can help people deepen the way that they are housing first. I think we all know people say they're housing first, but then when we really drill down, they're not really housing first. So I think this puts some meat on the bones of what that means. I think it can help programs have some more direction. I also certainly think it can help to move people along who are newer to it, because it concretizes what housing first means, which has been a real gap in the field for some of the home service providers. And then I guess finally I want to say, we know that switching to a housing first model and an approach across all the programs really does work. We have lots of evidence, and it's Veterans Day, and I want to wish everybody a happy Veterans Day, especially the veterans might be on this call, people who have served us. But we all do know that Housing First has really been a game changer for veterans' homelessness, and I think this tool can help support us all in doing more Housing First in our community. So thank everybody for the day, Friday afternoon at 1, your troopers. Turn it back to Victoria. I don't know if there's any closing remarks you want to make. Hello?
Sorry, my line went blank for a moment.
For a moment I thought, well, maybe nobody heard me.
Thanks, everyone, for getting on, and have a great weekend. And thanks, Suzanne.
Thank you. Bye-bye.
Bye-bye.